Here in this video, I'm going to show you how to measure the change in the volume of any mass which is on treatment such as chemotherapy or radiotherapy. So here I've got a case of proven lymphoma on treatment, and we have got this large nodal mass in the mesentery, and we can see in the follow-up CT the mass has reduced. The hematologists want to know what is the approximate percentage decrease in the volume of the nodal mass. So it's quite simple. So we need to measure the AP and transverse axis of the nodal mass in the first scan and at similar level on the present scan. When we have done that, we note that measurement and then we pull the coronal scan and then again measure the craniocaudal long axis. We have got three measurements, that is AP, transverse and craniocaudal axis. To calculate the volume, we need to multiply AP, transverse and craniocaudal axis view on the first scan, and we need to do a similar calculation on the second scan. And then we need to calculate the percentage change in the volume by using basic mathematical arithmetics, which we have all learned in our school days. If you think it is difficult to calculate or you have already forgotten this basic arithmetic mathematics because you are now a radiology registrar or a radiology consultant, you don't have time to do or you don't have time to do that mathematics, what you can do is you can write these measurements in the report, such as uh, the nodal mass measured uh, blah 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 in its AP, transverse and craniocaudal axis in the first scan, and currently it measures blah 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 in its AP, transverse and craniocaudal axis on the current scan. So based on this, the overall decrease in the volume is, you need to write in the percentage of decrease in the volume. If you don't have time to do this basic arithmetics on a calculator, or if you don't know what basic mathematical formula to use, you can copy paste this exact same format on ChatGPT or on Gemini and ask what is the change in the percentage of volume, and it gives back the exact calculation and the answer in about 10 seconds. And you can write that in your report, stating that the percentage volume of reduction in the nodal volume size is approximately by 80%, as in this particular case. So in summary, here I have shown you how to calculate volume of a mass on a CT scan, or it can be used in ultrasound as well, and then how to calculate the percentage of increase or decrease in the volume on subsequent follow-up scans. You can make use of ChatGPT or Gemini to help you out without bothering about remembering the calculation or using a calculator.